Hey folks, this is a very short video on ADHD. ADHD stands for Attention Deficit and Hyperactivity Disorder. So attention deficit is simple to understand. These kids, the small childrens, they lack attention. They're inattentive in the class. For an example, they hardly pay attention. They're not focused. So that's why attention deficit. And along with that, they have attention deficit, but along with that, they also are very in a hyperactivity state. They are they can't stay still at one place all the time. They need to do something. They are doing something. So this is ADHD. So it sounds okay. It maybe it's attention deficit and hyperactivity state. Now most of us might think like, yes, most of the kids are in a hyperactivity state. They are most of the time they hardly stay at one place and they keep on playing and all that. No, difference here is hyperactivity state is and attention deficit is because this is not comparatively to other kids, because here it affects your cognitive function too. Yeah, the IQ of these kids is quite less, not quite less, but yeah, it is less comparatively to other kids in the same age group, because their IQ is less, but maybe not particularly due to like their IQ is less, but because of inattention and hyperactivity state, you can hardly judge them whether in reality they have IQ less or not. But yes, one can say their IQ is less, but not yet confirmed was the reason behind it. Is it due to true ADHD, or maybe they are because they are not able to concentrate? So maybe that's why their IQ is less. So overall, it affects your cognitive behavior also. Because ADHD, basically it is because your all your dopaminergic and norepinephrine, especially the dopamine tracks, they are affected. Suppose if nigrostriatal pathway and striatal corticostriatal, to be precise, if corticostriatal pathway is affected, that goes to your prefrontal cortex. So prefrontal cortex again, which helps in your memory and cognitive function. So those pathways of dopamine going towards your prefrontal cortex in your frontal lobe, over there in your prefrontal cortex, if these tracks from your striatum towards your prefrontal cortex, PFC, if they are affected, then in that case the problem will be your cognitive dysfunction, your cognitive behavior would be affected. Alongside, pathway of this dopamine can be affected, and that can be of VTA, ventral tegmental area, yeah, in your midbrain. So that can be affected too. And as we know, dopamine and that also going towards your prefrontal cortex, or so that can be affected too. So in that case, we know it can be for the mood, it can be for the movement disorders, all these together, and plus mainly it can be for the reward. Yeah, so that reward pleasure, that can be affected. So these all things are interrelated. So that's why ADHD is a heterogeneous, we can say, disorder which affects, which has many particularities in it. And so main thing is your cognitive can be affected due to, as I already explained, due to your prefrontal cortex and your VTA. This area also has the dopaminergic specificity neurotransmitters and dopaminergic neurons present in it. So these all can get affected. And if you want to look at these two pathways of dopamine, I have discussed in a very another short video in another video. So ADHD, this particular is a very long topic, very huge topic. So I won't discuss all the specificities of ADHD, because it will take a long video to discuss that. But for the time being, if we talk about ADHD treatment, it's very simple. So this video is particularly all about ADHD treatment. So it's very easy to remember, easy to learn. ADHD treatment is, since we know ADHD treatment is attention deficit, yeah, and is hyperactivity. Both of them can be both of them can happen simultaneously. So for what you do in ADHD for attention disorder, and maybe as a whole for this, you can have two classes of drugs, not classes of drugs, two type of treatments. What can be used. First of all, what you can do is drugs that cause psychostimulant. Yeah, it can be psychostimulant that maybe that stimulates your particular parts of neurons in your brain. So those kind of stimulants, either you can use stimulants, yeah, so stimulants, but as we know, stimulants, what they will do is they will increase your norepinephrine, serotonin and dopamine in your presynaptic vesicle. So in presynaptic axon. So here, if your these three all are increased, yeah, these three, what they will do is acutely they will get increased, and what they will do is they will stick to these neurotransmitters, these receptors. They will come and they will stick, they will stimulate these receptors. Overall, what you will see is this disease, as it is, these kids are in a hyperactivity, agitated, and if you give these norepinephrine, serotonin and dopamine to these kids, they were in a agitated state, they were hyperactive and all that. So my question is, what if you give these neuroepinephrine, serotonin and dopamine? What they will do is, as we know that dopamine and norepinephrine, especially dopamine, they causes psychosis. Yeah, so already a kid is suffering from a hyperactivity state, and is it worth to give these stimulants to these kids? Yes, it is. Maybe because acutely they might become more agitated, but the benefits of giving these stimulants are, in the long run, what they will do is they will desensitize these receptors. Yeah, they will downregulate these receptors. What do we understand by downregulation or desensitize? The thing is, if they keep on stimulating, suppose these neurotransmitters, any one of them, they keep on stimulating these receptors all the time, all the time, all the time. Problem, what will happen is, these receptors, there will be a time when these receptors want function. They want to, like, if suppose there were 5 of these receptors present, only 3 of them, or only 2 of them will work. So 3 of them will desensitize, they will down regulate, they won't work anymore. So overall, what you did, the conclusion of this topic is, of this stimulant, is the benefit, advantages of these are, you stimulate acutely, of course they all will be there, but in a chronic use. So that's why you need to give them chronically. These chronic use is important, not acutely. Of course you will give, but you have to give these drugs for a long run, for a long time, because then only these receptors will desensitize. That means these receptors will decrease in number. So out of, suppose there were 10, only 2 will remain. So that's a good thing. So of course then less receptors are getting stimulated, and further your advantage is like less of norepinephrine, and these postsynaptic this neuron will get stimulated. So that's the main idea behind increasing these neurotransmitters. Yeah, so that's the idea behind it. So same thing, and what we can say is, by looking at this diagram, we can see increase of norepinephrine, serotonin, dopamine. We can say especially norepinephrine and serotonin, you can see that means you are giving a drug like amphetamine. Yeah, so that's why these are kind of amphetamine like drugs. Yeah, the main one of these drug, one must remember, is psychostimulant, is your this thing, methylphenidine. Yeah, methylphenidine is very important, methylphenidine. So methylphenidine will come into this category, a category of what, the one which increases your presynaptic neurotransmitters. But role of methylphenidine is to desensitize, downregulate these postsynaptic receptors. The other category is, suppose you can do is by giving psychostimulant, but as I mentioned, psychostimulants are not always a good idea, because they will give you acute phase with agitation and all that, because of course these are like drugs, amphetamine, as you know. Yeah, amphetamines, drugs used, psycho drugs in the clubs and everywhere. That's why they can increase your these acutely. So that's not a good idea. So that's why newer kind of drugs which are much more good. Rather than using psychostimulant, what we can do is non-stimulant type of drugs. So there were two categories, one was stimulant and one is non-stimulant. So non-stimulant, they are much more much more easy, much more beneficial for the patient, and much more easy to use. Because why? Non-stimulant, what they do is, this is presynaptic, and they don't have nothing to do with your receptor desensitization or downregulation. What they do is, I've shown a car here. So what happens is, reuptake inhibitors. They are the reuptake inhibitors. What do we understand by reuptake inhibitors? In reuptake inhibitors is, suppose norepinephrine, dopamine, and serotonin, whatever the neurotransmitter comes. Normally what happens is, we have a carrier. So suppose that carrier, I have drawn here a car. What happens is, these neurotransmitters, they come from here, and they come from here and they get inside this car, and this car takes them back into this presynaptic, and they can take it back to this presynaptic here, into this presynaptic neuron. So but what we do is, if we give this non-stimulant, these kind of drug is, they block this car. So if they block this car, that neuroepinephrine or these any one of these neurotransmitters, they will remain in this cleft, yeah, in this postsynaptic or postsynaptic cleft, yeah, in this space. So here they will remain. So if they remain here and they are not carried back to their presynaptic part, then of course their quantity will automatically increase here, and that was the role. Instead of so, and they will therefore they will act on these neurotransmitters. For an example here, getting my point? So here what we did is, we increased the quantity amount of these neurotransmitters, and therefore in the hope of desensitizing these transmitters. But in this case, in psychostimulant, you use too much of these. You are using drugs which increase this. So they have their own risk, because they are too much of norepinephrine and all that. They can cause your hypertensive crisis and many other things, serotonin syndrome and all those. So instead of preferring, we prefer instead of these, we prefer to use drugs which are not stimulant. Instead, they are non-stimulant. What they do is, they block this carrier, they block this car. So therefore, in other words, in pharma, what we can say is, they are the reuptake inhibitors. Yeah, they inhibit the reuptake. So this car role was to take those neurotransmitters back after some time, after a few seconds. Yeah. But by using these non-stimulant drugs, what you do is, you block this car, you block this reuptake, so this reuptake doesn't happen. So your neurotransmitters remains in the hairs. Hence, if they remain here, then of course their efficacy and their time of duration of acting on those receptors will increase. So this one is the more preferred. Non-stimulant is the more preferred class of drug to use in ADHD rather than using stimulant. So that's the difference between stimulant use and non-stimulant use. So very important example of this non-stimulant will be atoxametine. So this is very important drug, and clonidine also. Clonidine also can be used, but main is your atoxametine. So that's all. Thank you.